Let's go and see the doctor. That's going to make Cookie better.
Many of the hardest-to-treat pets in Britain
Right, it's hedgehog time.
are brought to one extraordinary practice, run by the man known as the Bionic Vet, Professor Noel Fitzpatrick.
What we're going to do has never been done before, ever.
He performs some of the most advanced procedures ever attempted.
It's the smallest total hip replacement in the world today. This is a textbook result. It's not even in the textbook.
As the lives of his patients and their families hang in the balance,
I've never seen an infection take hold this quick ever in my life, actually.
Noel continues to find new ways to give them a chance.
Of course, we don't know if it'll work.
That dog is the only thing that even makes me carry on.
Offering hope against all the odds.
Hello, hello.
She wants to say, hi, this is my new bionic leg.
It's just a miracle.
Every day, families come to the practice seeking a range of specialist treatments for their pets.
Morning. Hello, Jimmy.
We have dogs that come in on 3 legs that may have had an amputation, or dogs that come in on wheels or prosthetics.
Occasionally you do get a dog that walks through the door and you're all a bit like, whoa.
Wilson, come on in. Good boy. Good boy. What's this? It's a good lad.
This morning, a 3-year-old Newfoundland called Wilson has come in with severely deformed front legs.
It's a good lad.
He's already had several operations elsewhere. So for Donna and Darren, Noel is their last hope.
But it's very frightening because none of the operations before have sort of worked. You've got to think of him as well. Been through a hell of a lot. But obviously, he can't go on with bent legs for so long. I mean, he's like 70 kilos, so... And we can't lift him. We can't take him to the park and carry him. So we're hoping that something can be done for him.
Donna and Darren live in Bexley, southeast London, with a menagerie of animals. But Wilson is the heart of their home.
He's such a gentle giant. He's got an absolutely superb temperament, and he's a bundle of joy, and he loves people, and he loves kids and animals and everything. He's wonderful to own, and I love him.
When he was young, Wilson showed no signs of any problems.
He was absolutely a typical puppy, you know, charging about, had his toys, loved his little walkies. I started taking him to the proper training classes, and then it was during that time that the legs started to, he went lame. It was breaking my heart just watching him. I just couldn't bear it. I can't go on. He can't go on like this, and it's not fair.
All righty, I'm ready now. There we go.
You're a good boy. You go, baby.
Come on, big guy. Hey, mate.
Come on in.
So we're going to try and convert a walrus into a normal dog. Quite a challenge.
Noel has seen Wilson before, and he's examined the X-ray pictures from his local vet.
So he's got that big callus there, hasn't he?
Yeah.
He plans to operate on his front left leg first and do the right one in a few months' time.
What I think we're going to have to do is hold the elbow like so that it's moving straight up and down. And then I'll chop that wrist open, drill out everything that's in there in terms of cartilage, break the wrist, bring it around. That means stretching probably 60 degrees or so, that way. And then reattach it onto this with plates and screws. Not only do we have this issue with the wrist, but we also have the arm coming down straight and then turning into a hockey stick shape. All right, well, I'll do my very best, as you know. Hopefully we'll get a result. It's a challenging situation, but hopefully we'll get that.
It's major surgery, but it's Wilson's only chance to walk without pain once again.
He's been through so much, and we just really want him to, you know, be able to have a normal life. It's a big thing in our lives, and why he's not there, it's going to be empty. It's horrible. It's going to be really horrible. It's lucky they don't allow the owners to stay in the kennels with them, because that's where I would be right now.
I always think of how they'd feel when they have to leave their dogs, because it would be like leaving a baby, wouldn't it? We have had a couple of clients camping in the car park, in their camper vans, because they don't want to leave the animal. They might think their animal gets too stressed, but they do get the best care, so they are made relaxed.
Do you want to sit like a normal dog, or what is this? What is this?
It's lunchtime at the practice, and Noel's next patient is one of the smallest dog breeds.
You've got your silly tongue out. You've got your silly tongue out.
Tatijana has brought in her pack of Chihuahuas.
Belly rubs are favourite pastime. We can have belly rubs all day long. Some massage time. A little face massage.
At home in Chelsea, Louis, Harley and Teddy have the run of the place. Teddy is the youngest. Tatijana rescued him as an unwanted Christmas present.
You gonna do makeup too? No, you're pretty as you are.
I wasn't planning getting a third dog, and when I saw his photo, and straight away I knew that I have to have this puppy. They give you so much love, so much unconditional love. They're kind of like my spiritual guides, giving me a lot of advice. I'm gonna sound like I'm crazy, but they do. Kisses.
But when he was 5 months old, Teddy was diagnosed with a severe hip problem.
Teddy's in a lot of pain, and it's really bothering him, and he's just a little sad sometimes.
Tatijana is a keen dancer.
Good, thank you. Hey, Teddy, how are you? So my dogs come dancing with me, of course. Teddy is my #1 fan. He sits there at the front row and he watches his mommy, and he's so proud of me.
But watching is all Teddy can do. He's on painkillers for his hip and unable to join in with the fun.
For a puppy to have that restriction on him, that he can't play with other dogs, he can't do a lot of things, it's devastating for me to see that.
Come on, Ted.
Hi, Teddy. Hello, Mum. How are you? Lovely to see you.
Hi,
Sorry
nice
for
to meet
keeping you
you.
waiting. Nice to see
That's
you.
all right.
Hey, Ted. How are you? Let him hang out. I'll keep observing him. Just let him have a little walk around. When did you first get him?
I got him when he was about a month old.
Mm-hmm.
And
you've always wanted one, or?
No, I've got 2. I've never
Right.
planned to have a third one. It was
Right.
kind of like impulse.
Right. Hello, mate.
So now I'm sort of officially the crazy Chihuahua lady.
That's great. You're gonna make friends. It's all right, mate.
Noel has examined X-ray pictures of Teddy's hip.
It's a disease called avascular necrosis of the femoral head. That femur has a round ball, and this one is all eroded and collapsed because it doesn't have enough blood to supply the cells to grow the bone. All right, let's have a little look here. Okay, so the first thing I notice is the muscle on that side is considerably less. Now, if I move the left hip, just hold. I can move it right back there, no problem. I can move it right up there, no problem, okay? No problem. I apologize for the next bit, I just need to check one thing.
Yeah, I can imagine what's going to happen.
Okay, hold tight, I'll try and make it quick. Yeah, I'm sorry, mate, I know, I'm only gonna do it once, that's fine. Okay, listen, there's no question he's in pain. You can pop him down now. So you and I have to make a decision what to do.
I want him to have a good life, pain-free.
He's not going to be out of pain if we don't do surgery. There's only 2 surgical options that will get him out of pain. Femoral head and neck excision, FHNE, where you chop the head off, and then you hope for the formation of a fibrous pad here. And that is done in more than 90% of all small dogs in the United Kingdom. The second option is total hip replacement. It's become an option for these small breeds. Scientifically, practically, and in every other way, it's superior to femoral head and neck excision, but it's riskier. Your objective is to take this scenario here and convert it into a situation where you have a new head back in a plastic socket there. Do you understand the full implications of what I'm telling you?
Yes. Okay, well, let's go with the full hip.
Don't chew Mum's bag.
Oh no, okay, I'm gonna
Yeah.
get really mad at that one. After your surgery, there'll be no Gucci bags for a while.
Yes,
so there you
that's
go.
right.
Let's keep that
There
one
would
there.
certainly be, there'd be no Gucci bags for at least a year. All right. Okay. I'll see you later. All right, bye.
I'm sure I'll cry at some point today because I'm always emotional seeing goodbye to your pet.
So let's do a TPR, see where we stand. Very sweet.
I think it's just now that he's gone and all I have is a harness. And obviously there's risk with surgery, and we'll just hope and pray that Teddy recovers well.
In surgery, Wilson the Newfoundland is about to undergo the first of 2 major operations to straighten his severely bent front legs.
There's no question about it. It's a horrendous deformity. I just hope that tonight I get a little bit of luck.
It's a challenging operation for Noel. He's starting with the left leg, the most badly bent.
All righty, you ready?
Noel plans to remove the build-up of callus and deformed bone, then make a cut in the ulna and cut the radius in 2 places. He'll then be able to twist Wilson's leg a massive 60 degrees to straighten it. Metal plates will keep all the bones aligned. If all goes well, after 12 weeks, Wilson should be able to walk without pain or deformity.
Okay, hold that. Here we go. So this is the big callus that Wilson has been walking on. You won't be needing that, my friend.
To cut through the radius, Noel is using a specially shaped saw.
If I cut the bone with the ice cream scoop, I make a ball in a socket. And if I have a ball in a socket, I can rotate the bone in any direction. So it looks like that's okay. There we go. That's the crescent-shaped piece of bone right there. And that was the reason the leg bent in the first place. It bent around this fibrous line. In one fell swoop, we've cut off the callus, cut out the piece of bone that didn't want to heal, and made a ball and a socket. We can put that ball and socket together, and now we can simply twist the leg straight. Look at that.
But having cut the radius, Noel is still unable to twist the leg far enough around. He has no choice but to cut more fibrous tissue and ligaments around the wrist to get the leg straight.
It's remarkable how much I've had to rotate that, even more than I thought I would have to. I've had to bring it around almost 90 degrees. That is one hell of a lot of twist.
The new bone position is secured with plates and screws.
So I've put as much metal as I can fit in here. Okay, that's pretty good.
Harvested bone marrow is packed around the break and the drilled out wrist joint to accelerate healing.
I want to do everything I possibly can to stop this breaking.
It's taken an exhausting 3.5 hours of surgery to straighten Wilson's leg.
Oh man. He's got 41 screws and 3 plates in there. And you can see not only is the foot exactly in line with the elbow, so there's the elbow and there's the foot. That's pretty fine. That is as straight as is humanly possible to get it.
Wilson will be monitored closely over the next few days. He's suffered infections from operations before. If his wound becomes infected now, it could jeopardize his whole treatment.
Come on, Betty.
Every animal means the world to an owner, but I think assistance dogs definitely hold a special place in the owner's heart.
You can see anything from guide dogs to hearing dogs, epileptic awareness dogs.
They're there as a companion, but also there as a support as well.
German Shepherd Sera is in training to be an assistance dog for Caroline.
Good girl, thank you very much. Right. Yay, clever girl, well done you.
Caroline was involved in a car accident 29 years ago.
There you go.
It left her severely disabled. Although she has 24-hour care, Sera gives her some independence.
If I drop a pen, she can come and pick it up. It sounds like nothing, but it's huge.
Thank you, baby.
It just takes away one of those things that I have to ask somebody else to do.
Yes, good girl.
Having had Sera from 7 weeks,
Good one.
I'm properly a mum. She's everything to me. Sometimes I think it's possibly not healthy, but I don't care.
Come here, kiss, kiss. Come here, kiss.
But 7 months ago, Caroline realised Sera had a serious problem and had to put her assistance training on hold.
She jumped on the bed and it was like the bed had bitten her. She screamed and leapt straight off the bed again. And one of her hind legs was tucked right up at that point.
Sera was diagnosed with degenerative disease in her lower spine, but drugs and therapy haven't worked. So Caroline has now been referred to Fitzpatrick's for possible surgery.
Having broken my neck and having spent 9.5 months on a spinal unit, I know what the risks are. I've seen the effects when surgery goes wrong. If I eventually say yes to surgery, it will be a decision based on an awful amount of thought and trust.
For Caroline, it's a long and painful 200-mile trip to the practice.
Come on, sweetheart, come this way.
But she's determined to do her best for Sera.
Alrighty, we're about to see a German Shepherd dog. 3.5 years of age, quite young. Already been seen by one of my colleagues in neurology with lower back pain, which is very common in German Shepherd dogs, unfortunately, nowadays.
Come on, sweetheart, good girl.
They've already tried everything, it would appear. Lots of drugs and steroid injections into the spine multiple times. Nothing has worked. How are you doing? Come on in, come on in. Well, listen, Caroline, I've just had a look through the history. What we're looking at is this region of the dog right here.
Yeah.
So the very base of the spine.
Yeah.
So right down here.
Yeah.
At the lumbosacral junction. And we see it in lots of different breeds, but we see it very commonly in German Shepherd dogs. So the pain is primarily associated with squishing of this nerve here,
Yeah.
which is the origin of the sciatic nerve, and comes down through the pelvis where that plastic is there,
Yeah.
and over the side to form the sciatic. When you inject the steroid, which you've already had,
Yeah.
and when you do the laser, which you've already had, and when you do the physio, which you've already had, generally it frees it up a bit. And generally the inflammation goes down a bit. So that would be termed mild to moderate. That's not what this is. This is severe.
Okay.
Having undergone spinal surgery herself, Caroline is nervous about putting Sera through an operation.
Is there risk associated with every surgery? Absolutely.
Yeah.
Is there any surgery without risk? No. Is there any surgery with a long-term guarantee? No. So for these cases, what we do nowadays is we do a procedure called a distraction fusion.
It's an operation that Noel invented. It involves removing the swollen disc, pushing the two vertebrae apart with a spacer to reduce pressure on the nerves, and then fusing the vertebrae together with metal rods.
I want what's best for her. I've been to other places and had diagnoses, the same diagnosis, but I chose to come here.
Okay?
Thank you very much.
Right, lovely to see you.
A few aches and pains for me. It'll be worth it in the end.
Caroline has decided to go ahead with the surgery. If all goes well, she'll be able to collect Sera in a week's time. It's now 5 days since Wilson the Newfoundland had the first of the operations to straighten his severely bent front legs. But this morning, there's some bad news.
Oh, that doesn't look good.
The wound has become infected.
He's got some ooze there. That's not good. That's not what we want to see. That's my worst nightmare. He's had multiple operations before. He's had infection before. He probably has bugs in his system. And he's probably had bugs all along. If infection gets onto all of those plates and screws, then it could be game over anyway. All right, big guy, up you get. Off you go.
It's a big setback for Wilson. Noel has taken swabs for analysis. He can only hope that a new course of antibiotics will halt the infection. It's now late evening, and Teddy the Chihuahua is being prepared for surgery.
I do over 100 total hip replacements a year, but the tiny, tiny, tiny dogs are quite risky because you can fracture the bone as you put the implant in. You might not have enough bone to put the implant in. You can get nerve trouble. Or you can put the implant in and then it dislocates afterwards. Okay, boys and girls, here we go. Incision now.
The first stage of this delicate operation is to remove the disintegrating head of Teddy's femur.
That should be a complete circle. Instead, it's collapsed all here and it's flat, really flat, horrible. And chop it off.
It will be replaced with a new metal implant.
It's absolutely tiny. It's the smallest total hip replacement in the world today.
The plastic cup that will hold the head of the implant must be set into the pelvis.
I think I've got enough bone to hold the cup, but what I'm going to do is I'm going to put 2 screws into the bone around which I can pump the cement, which is like putting metal pylons into a cement foundation in a house.
Now the cup is set into the cement.
This cup is absolutely tiny. The future of this hip depends on the next 30 seconds, because that's how long it takes the cement to set from now. Okay, here we go. It's so easy to mess this up. If it's too open up, the hip will dislocate upwards. If it's too closed down, the hip will dislocate downwards. So this has to be perfect in 3 dimensions. Hopefully it will be.
With the cup in place, the stem of the implant is cemented into Teddy's femur.
Here we go. We're going to pop the hip back in now. Okay, that's the hip in now. All right, Teddy, you got 1 new hip. Let's hope that stays put. Feels all right. Let's go to X-ray. What you're looking for is that this ring is exactly at the center of that stem, and that the angle of the stem matches the angle of the ring, which it does. That's what I want to see.
Hello?
Hi, it's Noel.
Hi, Noel.
Teddy's operation went fine. It looks good on the post-op X-ray pictures. I'm happy with the way it went.
Oh, fantastic.
As long as the muscles heal around the implants, we should be fine.
Yeah. Oh, that's fantastic news. Thank you so much.
No problem. So far, so good. Fingers crossed. You know what? It's nice to be able to give someone their friend back fixed. That's what I'm supposed to be doing.
Packet Farrell's Blossom speaking. How can I help?
There we go. Come on, mate.
For Wilson,
go for a little walk. Good boy.
There's some good news. After 3 weeks of the new antibiotics, the infection in his leg is clearing up.
Come on, come on, come on. You're sprightly, aren't you?
It's given him a new zest for life.
That's right, mate. Yeah, I know. Yeah. I love you too.
We do see some dogs that come in that are quite over-friendly.
All right, then, sit on top of me if you must.
A lot of dogs go a bit crazy when they see Noel.
I'm trapped.
I think Noel definitely loves the attention. He might keep it secret, but he loves it.
Let me up.
Sometimes he just needs a hug, and a dog's the only one that will give it to him.
Well, you're able to use your leg. I'll give you that, mate. I gave him a new leg so he could hump better.
Wilson will need to return for his second operation, but for now, he's well enough to go home.
I'm so excited. I just want to get my hands on him. It's really difficult. You know, he's my boy, and I've not had him for 3 weeks.
There we go.
Remember?
Let's get in out of the traffic. Come up. There we go.
Darling.
How you doing?
Oh, baby Kate. He's a beautiful boy. You've got a straight leg, sweetheart.
His leg looks great, doesn't it?
It's fantastic.
He's bearing weight on it.
Wow, look at that.
I'm very happy with him. Good boy.
He's got the wow factor. Look at you,
Yeah.
beautiful boy. Oh, it's fantastic. He's been in pain for so long that to think that he can be able to walk around pain-free, it'd be great. He can be a proper dog now, and that's what it's all about. Let's go out and have a bit of fun and make some friends. It's just really good, and it encourages us with the other leg.
With one leg now successfully straightened, Wilson will soon be back for his second major operation.
Do some typing.
Here we go.
Right, you're more interested in eating rectangles.
Type.
It's mid-afternoon at the clinic, and Noel is preparing for an operation to try and cure assistance dog Sera's crippling back pain.
So right now we are going into a relatively risky procedure, and this particular procedure we invented, so I've been doing it a long, long time. But for this dog, it's the first time.
Noel's first going to take the roof off the spinal canal to access the affected area.
This nerve is being squished by this bulging disc and all of the new bone, which is why Sera's in pain all of the time.
To relieve the pressure on the nerve, the bulging part of the disc has to be removed.
You just got to be very careful when you do that turn that you don't cut a nerve. Now we've got a space in which we're going to put the device. We've got this Christmas tree here. We turn the Christmas tree upside down. As we drive it down between the two collapsed vertebrae, it's going to expand out like so and hold them apart where the disc used to be. All right, so the next step is absolutely critical. If we get this wrong, everything else goes wrong, and it could be an absolute disaster. You could paralyze nerves. Don't move.
Noel secures the spacer with a screw, then drills 2 further screws into each of the vertebrae and places clamps and rods between them to ensure the whole structure stays in place and the vertebrae fuse together.
We got a spacer device down here, and we got 4 clamps, 2 rods. Okay, we're closing up now. Hopefully everything will look okay in the post-op scan. Thanks, everyone. Cheers. As we've pushed the disc, the inflammation and the new bone away from the nerves, hopefully pain will be gone as well. It heightens the stakes a lot when you're operating on an assistance dog, because given that Sera is not 4 years of age yet, that could be a lifeline for her.
Oh, you are scary, aren't you, little baby?
It's a month now since Teddy the Chihuahua had his hip operation. He's been having regular physio and hydrotherapy sessions to help build up his wasted muscles.
That's it, good boy. Good boy. Yay, good boy.
He's made such good progress that today he's going home. For Tatijana, it's been an anxious separation.
I'm here to pick him up and to get that puppy love back in my life. I've been getting updates and pictures, and he's like getting bigger, and will he recognize me? Will he be happy?
Now, look who we've got here. Hi. There you go. Hi, Mum. I still recognize you. Ooh, bit of piddle on Uncle Noel. He's gonna pee on you.
He can pee on me.
Oh, dear. Come on now. Oh, dearie me. Dearie me. Dearie me. Pee everywhere. He gets very excited. He peed on Uncle Noel, peed on all the girls, kissed loads of girls. Didn't lick their teeth like he licks yours, though. I don't think they let him.
Oh my goodness.
Just to have him back in my arms, I just never want to put him down.
Walking on the lead, he's allowed to walk slowly. He's allowed 10 minutes 4 times a day. Okay?
So keep him separate from the other 2 dogs so they don't play.
Absolutely.
And they
He's
don't...
not allowed to play.
Real recovery and rehabilitation will start now. Thank you so much.
Okay, my entire pleasure. So good to see you smile. Hey, mister, we'll see you soon.
We've got some exercises to do. We can do them together. Yeah, like yoga. Mommy Teddy yoga. Yeah.
It's been 6 months now since Wilson the Newfoundland had his first front leg straightened.
Do not take me for a ride, please, Wilson. Hey? No, you got to stay. She'll be back.
Now, finally, he's back to have his other leg fixed.
He's doing really, really well. He's striding out, he's walking. I just can't wait for him to get his second leg going and off we go. Yeah, he'll be a changed boy.
Wilson's journey so far has been very long. Donna definitely wants to believe that he's going to run down the beach again one day, and I honestly don't know. It depends on this healing on the right side, and it depends on it not getting an infection. And those are 2 very big wishes. We really don't know at this point. All righty, let's do it.
The operation is similar to the first one, though this leg is not so deformed.
Hold the foot. Okay, boys and girls, here we go. So what we're trying to do right now is chop into the wrist and preserve as much of the blood supply to the foot as possible. Don't pull too hard, that blood vessel will rupture. So I'm putting 3 plates on now. I'm gonna anchor it down to try and pull the wrist across without re-breaking the forearm. That's the plan. Good. Actually, that looks really good. Hold that there.
The plates have gone in well, and the leg is now straight. But there's a problem.
I'm concerned about the ability to close the skin here because there's a lot of metal work in here. That is going to be very, very, very tight. I might not be able to close it at all. I need more skin. I'm just wondering if I could cut this toe off, this dew claw. He doesn't need this.
Using the skin from the cut-off dew claw gives Noel just enough to close the wound, but there are still big challenges ahead.
We know that he's at very high risk of infection from before, so he probably has bugs inside him right now that will flare up again. If we're lucky, we'll keep him under control. If we're unlucky, we'll have an ocean of pain. All right, let's rock and roll. I think I might die.
It's 2 a.m, and after a long 3.5 hours, the operation is complete.
Hello?
Oh, hi. Donna.
Hiya.
Oh, I've done it. It was challenging. We now got to hope that there's little swelling. We got to hope that there's a blood supply and a nerve supply that holds up to the foot, and we got to hope that infection doesn't set in.
Yeah.
So.
Right. But he's all right in himself, yeah?
He's better. He's in better shape than I am right now, I think.
Oh, dear. Oh, thanks very much. Good
Keep
luck.
your chin up.
I will.
See you. Bye.
Bye.
It's a late finish for Noel.
There are only a certain number of hours in the day, and if I have to consult each day and operate each day, then that means I don't get into theatre till lunchtime, and it takes however long to do the operations. Good night.
I have no idea how Noel does it. He has got years' worth of sleep to catch up on, but I don't even think he has time to do that.
People wonder why we do this at night. Well, that's because we run out of time.
It's like the evolution of man, so he kind of starts off at ape level, and then throughout the day we get full human. When it gets to the night, that's when he comes into his own.
Alrighty, you ready? Let's go. Good girl, Sera. Good girl.
It's a week now since Sera, the assistance dog, had her spinal operation.
Good girl, Sera. Well done. That's great. That's good, isn't it? She's certainly in less pain 1 week out than she was pre-operatively, and hopefully will only get better from here on in. Yeah, she's doing well now, taking every step with confidence. Doesn't need any real support. That's awesome. Yeah, she's good to go.
Sera's owner, Caroline, is tetraplegic and has been unable to travel to the clinic today. So her care team have come to collect Sera.
1, 2, 3, go. That's it. There we go.
Sera will be back in 6 weeks for a checkup. And if all goes well, she should be ready to restart her training as an assistance dog.
Yeah, that's fine.
But for Wilson, the Newfoundland, the news isn't so good.
Can I get some light, please?
A week after his second operation and the wound still not healing.
Yeah, that's not working.
Noel is running out of options.
It's a major problem. The wound is not healing over the plates, so we're not going to get closure. We've got probably the same infection back that he's always had since he came into the practice in the beginning. We can't stitch it because it keeps breaking down. We're going to have to use vacuum-assisted closure.
Noel seals around the wound and uses a vacuum pump to suck out excess fluids. This will increase blood flow and can promote healing.
I honestly don't know if Donna wants to keep going.
This is a serious situation for Wilson. His family will face a difficult decision.
I'll need to give her a ring. Hey, Donna, it's Noel. Wilson's finding himself, but the wound is not going well.
Oh.
Basically because the skin is not holding up over the plates.
Right, oh God.
We have this enemy, which is most likely the same bug as he's had before.
Yeah.
I have to ask the question, even though I don't want to ask the question, and that is, you do realize that this is a big complication, and obviously euthanasia or amputation are possibilities at any time.
God. Right.
I mean, I'm not saying that you have to choose those, but I am legally and morally required to give you those choices.
Right, okay.
Do I take it that you want to continue?
Oh, definitely.
Right, okay. Yeah.
I know you'll do everything you can possibly do to help the boy.
Okay,
I'll
thank you,
give up
Donna.
now.
Oh, yay!
For the past 2 months, Wilson the Newfoundland has been given every possible treatment to beat his infection and close the wound on his leg. The practice recently acquired a hyperbaric oxygen chamber, which can help speed up healing.
So now we need to start timing.
Wilson has been spending time in the oxygen-rich atmosphere.
Big day for Wilson today. He's been having the hyperbaric treatment for 2 weeks now.
Hi, good boy.
And the wound has been healing in all of the time. It will be really good if we can get to the end of this journey. Okay, so that hole's much smaller now. That's good. Okay, so that's a better situation. I'm not going to close it completely because I still want any residual infection to have a drainage point. I'm not expecting a miracle here, but maybe we might get a little bit of luck. Who knows? Poor fella deserves a bit of luck at this point.
In London, it's been 3 months since Teddy's hip operation.
Good boys.
Tatijana's Chihuahua posse are back to full strength.
Good boys. Come on.
It's incredible to see what a transformation. He's like a totally different dog.
Ready? Go, Teddy. Go. Go, 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 go. Good boy.
He couldn't sit, he couldn't jump, he couldn't run. He basically couldn't do anything. Now he can jump, he can run, he can roll, he can play, he can chase. Anything's possible with Ted. Look at him fly. To see him use his forelegs and be so fast and so happy. I never thought this was going to be the outcome. He's going to get it. He's going to get it. Ready, steady, go! I think Noel hasn't given him a hip. He's given him wings. He's like the fastest dog ever.
Back at Fitzpatrick's, there's finally good news for Wilson too. His leg wound has recovered enough for him to go home. After a 9.5-week separation, Donna has come to collect him.
Hey, nice to see you smile. So this is the X-ray picture of where we're at now. Healing very nicely right across.
Yeah.
We're almost there. We're tantalizingly close. I think he'll benefit now from being at home. And everybody will actually miss him. He's like part of the furniture here now. It's part of the he's part of the family. Yeah. But he's ready to go.
Baby! My darling, hello! Oh, I missed you.
Hi, Mummy.
Oh, baby.
Hi, Mummy.
Missed my boy. Oh, I have. Missed you so much. Missed you. Oh, it's beautiful. He's looking fantastic. Yeah, look at you. Look
Let's
at
walk
you.
him outside.
And he's really tall now.
He's great.
Great.
Yeah, of course, because he's straight. He's now tall. Come on outside. No.
Oh, look a treat on the way by. Yeah.
So you can see he's walking great.
Yeah. Oh, it's fantastic. Look at you, baby.
Come on.
Oh, he goes on the back seat.
Now.
Oh, my God.
Whoa, careful.
Oh.
Good boy.
Good lad.
Well done.
It's just like a emotional roller coaster and a torment because you just don't know how the outcome was going to be. And so, especially in the early weeks where it was a bit iffy, just relieved to get him back. I'm so relieved to get him back. I mean, not say 9.5 weeks, a long time without my fluffy bear. Really long time. There he is, look. He's my boy.
It's been 6 weeks since assistance dog Sera had an operation to fix her painful spinal disease. Now Caroline has brought her back for a checkup.
Having her home was amazing. The week without her was absolute hell. The house was so empty, it was horrible. At the moment, her training's on hold until she's 100% fit. I just want her back to being healthy and happy. She's my baby first, and her assistance work comes second.
Hello, Caroline.
Hello.
How are you? How are things going? Do you think there's been progress clinically?
Yes.
Okay.
Definitely.
So how is that manifested?
She's a lot stronger on her hind end. As of Thursday, we started to get a little bit of a lift in the tail and a bit of a pendulum effect.
Yeah.
And 2 days ago, we got a wag.
Okay. Good. So the nerves are all recovering.
Yeah.
Let's get the CTs and we'll figure it out. You can just take her through on that and then change out.
I'm coming back for you, I promise.
Off you go. Good girl.
Noel wants to check that the bone is beginning to fuse around the spacer, screws and clamps in Sera's spine. It's an anxious wait for Caroline.
Come in.
Hi there. These CT scans and X-ray pictures look good.
Oh, thank God for that.
Everything is quiescent, meaning it's quiet. It's the same as it was when I put it in there. So
Cool.
I'm happy with that.
Thank goodness for that.
So her clinical status will continue to improve, hopefully till week 12. You don't need to do anything.
Okay.
You just need to let this settle down. Right now you can walk as long as you like on the lead.
Okay.
And after week 12 you can let her off lead.
Yeah.
So I will go and get her.
Okay,
All
thank
right?
you.
No worries, my pleasure, my pleasure. So it's all good. Now,
Hello,
literally
gorgeous
pulling me
girl.
around.
Hello,
She's got a lot of
sweetheart.
strength in the back end now.
Hasn't
She's
she
literally
just?
pulling me around, yeah. Her strength level is massive by comparison to what it was.
Yeah.
She will literally pull me. You can put a sled on her. Take care, Sera. Be a good girl. All right, be a
Sera,
good girl
say
for
thank
Mum.
you very much.
Good girl. Delighted to see her looking so happy.
Thank you.
Delighted to see you looking so happy. Take care.
Absolutely. Right, bye.
Bye.
I got the results I wanted, but I'm just thrilled to bits that everything is exactly how it should be. So we can start getting out and about again and going for a walk. What do you think of that, Sera? Just totally relieved that I did the right thing for her, because it's the biggest decision I've ever had to make in my life. Yeah, for you. Love of my life, she is.
In southeast London, Wilson the Newfoundland is well on the road to recovery.
Wilson's legs are absolutely fabulous. They're lovely and straight. He's walking superbly on them. He's absolutely great.
He'll be having the plates from one of his legs taken out soon. Until then, he'll stay on antibiotics. But at last, he's enjoying a more active life.
You can actually get around like a normal dog, take him out for proper walks, don't have to keep lifting him.
He can stand really well now for long periods. He can sit, which he couldn't do any of those things before without me helping him. Yeah, he's just like a proper dog. Come on, keep going. He's everything I could hope for. He's beautiful.